Hi, this is Mrs. Reichelt, and we are officially done with all of our microscopic stuff. So we're moving into the large muscle movements that I knew you were excited about. So muscles and body movement is what's up next. So the movement is attained, so muscle movement is going to be attained due to a muscle moving in attached bone. So muscles are attached in at least two different points. In a lot of cases, there are several different places where muscles attach to different types of bones. So the first thing is an insertion. An insertion is an attachment to a movable bone. And then we have an origin. And an origin is an attachment to an immovable bone. So I just want to let you guys know, for those of you that are printing out those chapter outlines, the book actually went through and defined these oppositely. So they have origin is movable and insertion is immovable, but it's really just the opposite. And your book, if you're reading along in your textbook has it written exactly right. It's just whoever went through and was writing out the outlines for these got those backwards. So just make sure that if you're looking at those that you switch those around. So the insertion is to a movable bone, and then the origin is immovable. And when a muscle contracts, the insertion moves towards the origin, because again, the origin's not the movable part, it's the immovable. So the insertion is going to move towards that. So our first couple types of body movement. We have flexion. Okay, so flexing, this is going to decrease an angle of the joint. So if normally it looked like this, now it's going to look like, or I guess if normally it looked like this, now the angle is going to be smaller. This is going to bring two bones closer together, and it's typical of hinge joints like your knee and your elbow. Extension is going to be the opposite of flexion. This is going to increase the angle between two bones. So if this is flexion, extension is going to be the opposite. Okay, you're increasing the angle. And then you also have hyperextension, which could be kind of classified as its own. Hyperextension is when you increase the angle more than 180 degrees. So these pictures came directly from our book. It would be kind of weird if I just randomly had these lying around. But so flexion is going to be something like if we have our knee and then we're flexing it, raising it this way. Extension would be if we go back down. Same with extension is going to be if we move this way. You can also do the same thing with your neck if you decide, and actually I think the next slide goes through that. So flexion would be like if you decreasing the angle from your chin to your sternum. Okay, that's flexing. Extending would be going back up, so you're this picture here, and then hyperextension would be bringing your head back this way. So I think those ones are pretty obvious. So let's go ahead and move towards the next one. Then we have rotation. Rotation is the movement of a bone around its longitudinal axis. This is common in ball and socket joints, and the example is when you move your atlas around the dens of the axis and you shake your head no. So rotation is just going to be that no motion. You can also have lateral rotation and medial rotation as well, but the common one is going to be shaking your head no. Then you have abduction and adduction. For some reason, every year, these ones are the ones that people confuse. So ab with a B, abduction, you're moving your limb away from the midline. Okay, abduction is away from the midline. So abduction is going to be if you're in anatomical position and then you move your arm away from the midline. Adduction is the opposite. Adduction is when you move towards the midline. Okay, so you're moving towards the midline. So abduction, away from the midline. Adduction, Abduction with a D is going to be toward the midline. Circumduction. Now, circumduction is a combination of flexion, extension, abduction, adduction. Okay, circumduction would be like if you had your arm straight out and then you moved it in a circle. Okay, and this is common in ball and socket joints. Then we move into dorsiflexion. Dorsiflexion is if you are lifting your foot so you're standing on your heels. That's, for me, standing on the heels. If you don't want to write a whole bunch, dorsiflexion is standing on your heels. Then plantar flexion, this one would be stepping on your tippy toes, okay, pointing your toes. So ballet, I think there's a question somewhere, probably on a test, talks about the difference between plantar flexion is going to be like a ballet example. You're pointing your toes out. Then you have inversion. When we do our quiz on all of the different types of body movements, inversion and eversion are the hardest ones for me to know if you're doing these right, because it kind of, inversion doesn't hurt too bad. Inversion is when you're turning the sole of your foot medially or towards the midline. Eversion is when you turn the sole of the foot laterally, and for some reason I kind of think that eversion sort of hurts, so try it right now and see what you think for your feet. So inversion is pretty easy, and then eversion is kind of tricky, or maybe it's just tricky for me, I don't know. Okay, so then we move into supination or supination, if you want to call it that. Most of you probably will want to call it supination, but supination is when your forearm rotates laterally so that your palm faces anteriorly. These are a whole lot of words for to say your supination occurs in anatomical position. So, in anatomical position, your radius and your ulna are parallel, okay? And then pronation, this is going to be when your palm faces towards the posterior. So this would be supination is when your palms are facing up. Pronation is going to be when you turn them over. What happens now is your radius rotates over your ulna, okay? So that's supination and pronation. And last up, your last different or type of movement is going to be opposition. Opposition is when you move your thumbs to touch the tips of your fingers. So it's like you take your index finger and touch your thumb, then your middle finger, touch your thumb, then your ring finger, touch your thumb, and then your pinky and touch the thumb. Okay, so each of those are opposition. So I hope that those were pretty easy. I think that the first couple at least you know, and hopefully there's not too many to remember there.